Thank you for being with us for this panel discussion. This is on the topic Creating Digital Healthcare Ecosystem, which is discussion on Ayushman Bharat Digital Mission. In this session, our expert team of panelists will discuss on topics such as Health ID, Aadhaar number, Ayushman Bharat Digital Mission, and creating digital healthcare economy. For deliberating more on this topic, we have Dr. Minnie Bodhanwala, who is the Chief Executive Officer of Wadia Hospitals. We have Mr. Gautam Khanna, who is the Chief Executive Officer of PD Hinduja Hospital and Medical Research Center. We have Dr. Santosh Shetty, who is the Executive Director and CEO of Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute, Mumbai. We have Professor Dr. Rajiv Prasad, who is the Acting Principal and MSVP at MJN Medical College and Hospital, Cooch Behar. Virtually, we have Dr. J.L. Meena with us, who is the Division Head of Service Provider Engagement of National Health Authority, Government of India. Dr. Minnie Bodhanwala would be leading this session, so I hand it over to you, ma'am.
A very good afternoon to one and all, and especially to all the speakers over here who have taken their time out and come to join us for this wonderful interactive session. I think it's going to be a wonderful knowledge sharing session with everybody. The Ayushman Bharat Digital Mission is creating digital healthcare economy, benefits of health ID card and ABHA number. Necessary steps are taken by hospitals and medical community to integrate the ABDM into the care systems. The scope of public-private partnerships in further enhancing unified health systems and exploring challenges associated and the scope of improvements is going to be the platform for discussion. So I think first I would like to put a round of questions to Professor Dr. Rajiv Prasad. Very good afternoon, sir.
Good morning. Good morning.
The Ayushman Bharat Digital Mission aims to develop the backbone necessary to support the integrated digital healthcare infrastructure of the country. What steps are hospitals undertaking to support this integration?
As you know that previously the health insurance was the concept of metro cities or urban cities, even after just 10 or 15 years back. But now most of the state covered up through this mission, more than 60%, even in few states it's more than 80%, 85% around. So it's now this concept may help to open the treatment option for the rural people, because I'm working in the rural areas. So I saw these things. Now they can choose the treatment option, whether they go for the government setup or they can go for the private setup. Going with current experience, I am seeing that gradually the hospital care, especially in complicated major cases, patient admitted, all the patient prepared for the operation, suddenly patient would take DRBs and get admission in the private hospitals. And for this, and so this in our Bengal, this is called Swasthya Sati card. Then the nursing homes in peripheral area, even in small cities, gradually increasing, because the money they are pay the rural poor people, those income is even living in the below poverty line. So they are able to pay through this Swasthya Sati scheme. And those are in middle class families, they are also availing the same services. And even big setup like Apollos, they are setting up the new setup in the small cities like Siliguri, even in the Assam areas. I think this is a big option for those people staying in peripheral areas. I think it's an revolutionize the healthcare system and health industry in future, very, very shortly. Anything else?
Thank you. The next question is to Dr. Santosh Shetty. Sir, what areas of opportunities and challenges do you identify for hospitals in the process of data integration and standardization for enabling the digital health ecosystem under the Ayushman Bharat digital mission? I think this is a very interesting question for you, Dr. Santosh.
Good morning, and it's a privilege to be here. And the theme of the conference obviously is very, very apt because it is the hottest topic in healthcare currently. So if you look at digitization in healthcare in hospitals, I would say there were a few islands of excellence, which is large corporate groups or standalone large hospitals who have made investments in digitization and in collecting data appropriately. But it has been fairly fragmented. If you look at what happened during the course of the COVID pandemic, you would see that most of the information flow, like what was mentioned in the earlier session, happened over WhatsApps. Even in a large city like Mumbai, you had lab reports which were being circulated on WhatsApps. You had Aadhaar cards which were being circulated in WhatsApps. So as hospitals, we would receive lab reports, Aadhaar cards, and then try and admit these patients. So if you look at it, there has just not been any seamless way for data transfer. And that is where the digital health mission can clearly play a very, very big role in terms of the seamless transmission of patient information across various stakeholders in the healthcare ecosystem. So whether it's labs, pharmacies, hospitals, imagine a scenario where a patient just walks into the hospital without a single piece of paper and a card, and all the information about all his previous episodes across the various stakeholders is available over there. How will this help? Of course, from a patient point of view, there's going to be no repetition, no repeat consults, no repeating investigations. It brings down the possibilities of errors. For hospitals, when you have all the information available at one point in time, the decision making becomes so much more easier. If data is captured in a structured format, then big data can be used for various applications across the board, whether it be for clinical applications, for operational applications, for financials, or for epidemiological. So the entire potential which is there for big data using AI is immense, and the hospitals can get into each of these areas over a period of time. Of course, with these exist challenges. The biggest challenge, I would say, is mindset. Healthcare and hospitals specifically have been laggards as far as usage of IT goes. It's only recently that more and more we've started realizing that IT is not a cost center, but actually a profit center, an enabler of healthcare. So that, I think, is the biggest challenge that hospitals have to realize, that it plays a very, very big enabling role. Second thing is, I would say, the big elephant in the room, which is the clinicians. How do we motivate clinicians to actually enter data online at all times in a structured and standardized format? That is the other big challenge that I see in healthcare. And of course, the usual challenges with data in terms of data validation, data integrity do exist. But overall, I think the opportunities are huge, they are immense, and we are at this point in time only scratching the surface. Thank you very much.
Thank you, Dr. Santosh Shetty. I think that was very enlightening to all of us. Can we have Dr. J.L. Meena to join us?
Yes, ma'am. Good morning, ma'am.
Very good morning, Meena, sir. How are you, sir?
Was fine, ma'am.
Okay, sir. The question for you is, being into the system yourself, the current bottleneck is digitalization of the health records, for which we need to ensure it becomes easy for doctors to inculcate digital habits. How can this be achieved for realizing the concept of unified health interface initiative launched by NHA? I think that's very interesting for you to give us a brief update.
Yeah, yes, ma'am. Thank you very much, ma'am. And thanks to organization for calling me as a speaker. One is the important things, the national health authorities, the two main program is there. One is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, where we covers more than 50 crores beneficiaries. And it's totally treatment is totally online systems, digitalized system is there. That beneficiaries from the Jammu and Kashmir take the treatment in the Kerala beneficiaries take the treatment in the Assam, so each and everything in the impaneled hospital, and about 27,000 hospital is already impaneled. And within short period, more than 3 crores beneficiaries take the treatment in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The another important program is the Ayushman Bharat Digital Health Missions. In the Ayushman Bharat Digital Health Mission, as you know, the three part is there. One is the Ayushman Bharat Digital Account, is the individual beneficiaries account. And another is the Ayushman Hospitals Facility Registry. And second most is the Professional Facility Registry, especially with the doctors and others. Related to the digitalizations, I think it's a very important thing in the, we are already focused on the digitalization because if you want to succeed any programs, you want to cultures for these programs. And that's why for the cultures, one is the important, when I say for the improvement in the quality, I think the quality is only achieved when you appreciate the better performing hospitals or better performing personals. If you are, most of the hospitals in the India also presently have the digitalizations. So we are thinking that we give the incentivize those hospitals which already use the digital platform in the documentation and other things. Because if you have the documentations on the digital platform, it is very easy for the claim processing also related to the pre-auth, related to the claim processing, related to the discharge summary, because it should be a system-based system rather than the manual systems. And that's why it's very easy to claim processing and payment also. Related to, because in the MBBS curriculum and others, the nursing and other pharmaceutical curriculum, there will be many minimum part of the digitalization. So we are also thinking from the national levels, we are also include in the curriculum of the MBBS or MD or nursings or pharmacists, all the healthcare workers, we are thinking to include in the curriculums. So they know, and better culture is created. Related to the IT infrastructure, because we know the each and everyone is not an expert in the IT, but how we solve the IT problems, like rather than the typings, can we identify the speech text? So the easy to digitalization, when you speak, everything is typed. So it's, we are also thinking on this speech test. So it's very easy. And incentivizations not only for the hospital, but also for the doctors and other paramedical staffs, which are focused on the digital health missions and digitalization of health records. After the incentivization, when we create the cultures, the next step is the some documentation of the mandatories. So which is also easier, especially the mandatory of the, like the discharge summary, we can mandatory. The some 111 part is the mandatory according to the standard treatment guidelines. So in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, we are also ongoing that according to the procedure, these are the standard treatment guidelines, and according to the standard treatment guidelines, if any hospital give all the documents in the digital form, we give the extra incentives. So the culture is also created, the hospital also motivated, the doctors and other paramedical staff is also motivated. So motivation is very important to this technology. And the digital health records, especially we are also focused on the, because we are also focused on the Ayushman Bharat digital account, especially beneficiaries, because most of the beneficiaries face that difficulty when they go for any tourism, like if Kerala beneficiaries come to the Delhi and suddenly he is sick, then it's very difficult to take files, each and everything. So we are also motivated the beneficiary to digitalize their health records. So which is easy to see anywhere in India, anywhere in the countries. And if we go to the outside of the countries, it's also very easy to take this all the medical records in out of countries also. So we motivated to the beneficiaries, we motivated to the healthcare faculties, doctors, paramedical staffs, and also we are motivated to the hospitals to create this culture of the digital health missions.
Thank you, Dr. Meena.
Thank you.
Mr. Gautam Khanna, the next question is for you. NDHM is built on the principles of ensuring greater inclusivity, efficiency, and transparency in the health sector. All doctors, hospitals, diagnostic labs, and pharmacies can have a digital identity. But participation in NDHM will be voluntary for both patients and providers. What are your thoughts on making a unique health ID, or as you call it, an Ayushman Bharat health account, mandatory?
Thank you, Dr. Minnie. And it's a pleasure to address all of you, and just heard from Dr. Meena. Thank you for your comments. I have a little different thinking on this, that if we make something mandatory, it may succeed, may not succeed, but it's important to ensure that the benefits of adoption of ABHA by everyone is understood. So just if I'll take a minute to talk about that. So how does these things evolve? I mean, how did Aadhaar evolve? How did WhatsApp grow? How did our phones grow? It is not because somebody made it mandatory. It is because people saw the benefit of it. And to give you highlights of what ABHA can do. Now think about it. We have maybe 50, 60,000 hospitals in the country, and only a few hundreds are more than 100 or 200 beds. So rest of them are 20, 30 beds. So they're all very, very small hospitals. And the price difference between a small hospital and a large hospital is present. We need to recognize that. Now, if the patient is given a choice that patient has access to their own record, they will be able to access the nearest healthcare facility, whichever is close by, depending on the disease severity, and they might get closer treatment, faster treatment, maybe cheaper treatment. So the benefit will be understood by the patient. So there is that benefit of ABHA. The other thing which we have to understand is that once I have control of my record, I have more power than the other side. Till date, the patients have not had power because the records are in a system, in a hospital or wherever. So patient has to ask for it. So if the patient has the records, the patient can move to any place they want. They can have a collective voice. So there are lots of benefits of having the ABHA. The third thing is, the moment I have access to my records and I am sharing it with hospitals, I will share it with the diagnostic companies. I can share it with companies which are into preventive healthcare, or in any other company in the ecosystem. Suddenly, the whole ecosystem is working on one identity called ABHA. And that benefit is being seen to people, and that will grow over a period of time. So that is something which I request Dr. Meena in his capacity. I think the more information and more benefits we can convey about ABHA and the digital mission to the patients, ABHA will be adopted. So mandatory, I'm not so keen on. The other thing I just want to say for a minute, one of the biggest concerns is the privacy. And I know government has been trying to address the privacy aspect of the data. So the fact that the organization, the provider which creates the record is the repository of the record, is the custodian of the record. And only through that, what we call as the HIECM, the exchange, the information is sought. There is privacy, but I think that also needs to be conveyed. So short answer to you, Dr. Minnie, is that I am in complete support of people adopting ABHA, digital mission. Making it mandatory, not so sure, but knowing the population of the country and our digital savviness, I think it will grow very fast, very soon.
Thank you, Gautam. You have, I think, enhanced to some very interesting, important points as takeaways for Dr. Meena to handle. Now, I think we shall be joined by Mr. Neeraj Lal. Second round. So by the time Neeraj joins us, we'll start the second round of questions. Professor Dr. Rajiv Prasad, this one for you. What aspects of the Ayushman Bharat digital mission do you feel still needs to be revisited for enabling effective delivery of digital healthcare across the country?
Digital healthcare importance of is gradually increasing. Because especially again, I say that this is much more important nowadays for rural people, and it is not impossible to avail by them because everyone now carrying the Android phone. As you know, we know that 60 to 70% people are staying in rural areas, and the super specialty services are far away from them. Especially super specialist service, neurology, cardiology, endocrinology, rheumatology. They are just getting the primary health care at basic primary health care or in the secondary care level, just like specialist services, not the super specialist services. In West Bengal, our government started Sastho Ingit, that means telemedicine services, where the digital services are playing an important role. The basic steps started from the PHC level, where the government of West Bengal posted the community health worker. Community health worker, those staying in the rural areas, primarily contacted the community health worker. If they are able to treat them, they treat. Otherwise, they can communicate through the phone or over telephone to the nearby subdivision hospital specialist or subdivision district hospital specialist. In state, then if this is not possible, the specialist may contact to the nearby medical colleges, because every time we post it and make a roster and telemedicine unit separately, and it's distributed all among the state in all the health facilities level, so that they can avail services from. And if someone is not some services is not possible to maintain from this level, then they can just our state apex bodies situated in the state. We can contact the patient party with all documents, come to the nearby AST hospital or subdivision hospital or medical college. We can send the documents to the apex body, and they advise, and as per the advice, we can the specialist doctor or the advice directly to those staying in the peripheral areas, and they avail the treatment. This is I think, revolutionized the super specialty services. And when the treatment required, we send the specific date as I am staying in the Kozhikode, which is far away from Kolkata, 700 kilometers. It makes mass harassment free and hassle free to the rural people. Those because everything is fixed up for his or her, that on that day you go and visit with all necessary completed investigation, and one day he may return from the Kolkata. This service is very much helpful nowadays through this digital mission. I think that our Swasthya Sathi card or Ayushman Bharat is not tagging with this telemedicine services. This is very much important. As Dr. Meena my previous speaker, told that encouragement of the health facilities and worker is very much important. So for encouragement to the health worker, if we tag the Ayushman with telemedicine services, they will participate more actively. So this will be helpful for us. And digitalization of all hospitals is one of the important reason because as you know, many times in government sector, patients don't know bed availability of the hospitals. Every time in newspaper, this patient referred to this hospital, then there is no bed available, then shifted to another hospital, then from another, after revisiting 4 hospital, patient die on the ambulance. This is such a very hot cake news of the new medias nowadays. To avoid such thing, we are adopting a new policies that our website created and web display is available, and everyone can see what is the bed availability in any hospital. In any hospital, what is the bed availability of the CCU? What is the bed availability of a trauma care unit? What is the bed availability in the SNCU? Even one of the important thing is blood crisis. Blood. Patient don't know if blood required medical. Often the hospital issues leke aao, 4 bottle blood leke aao, but they don't know where to go. Through the app, we can see that where is the blood available. My blood is A negative, then I can go to this blood bank and I can take blood from this level. This is the digital mission is very much now important to make treatment much more available to all the people. Now the scenarios changes. Through one Android we can make everything possible to everyone. So it's, I think, very much helpful, the digital mission.
Thank you, Professor Rajiv Prasad. We'll be asking the next question to Dr. J.L. Meena, who is with us online. Can open source technology be an accelerator for the Unified Health Interface Initiative for digital healthcare in India?
Yes, ma'am. Yes, ma'am. I think open source technology is very important. Because of the open source technology, we have the number of the resource. And another is important thing, that there will be no restriction and limitations. Because if we are not going for the open source technology, then the restrictions and limitation is there. But due to the open source technology, there will be no limitation and restrictions modified in the applications. And it's very easy and flexibility to change the tools which is used according to the practical reality and according to the India's digital health missions. And the another is important things related to the, because when we thinking for the digitalizations, and in the India, we have the huge amount of populations and doctors and hospitals. So the cost is also very important things. So in the open source technology, cost is also benefited rather than the others. So it's cheaper than the others technology and easy to modify it, and the number of the resources also available. So open source technology is very important, and many IT languages also there in the open source technologies. So it's also very important that in the India, different languages also there, and that is very difficult to only one language is focused. So if you focus on the open source technologies, the number of the language IT technologies also available. And finally, the accelerator of the identified health insurance schemes. I think so. The one is the measure is the open source technology, because recently we are focused on the digitalization of the all documents, which is helpful for the pre-authorizations, for the claim processing, for the discharge summaries. So we just identify the according to the 18 documents for digitalizations. And we give each and every digitalization form to open source technology, how they modified, how they give, how the price is coming. And then after the digitalization of each and everything, I think we find the good resource from the open source technologies.
Thank you, Dr. Meena, for enlightening us with the open source technology and how Ayushman operates. The next question is for Dr. Santosh Shetty. Technology is a powerful disruptor that has revolutionized and accelerated the growth of a large number of sectors such as healthcare. Please share your views on data driving future of healthcare.
Thank you, Dr. Minnie, for that question. So both technology and data are actually going to bring about a paradigm shift as far as healthcare delivery goes. And that will encompass all aspects of healthcare, whether it's going to be diagnostic, whether it's going to be therapeutic, or whether it's going to be preventive healthcare. I mean, to give you some real life examples, during the COVID pandemic, we worked with various software providers who had developed algorithms for X-rays and CT scans, which could pick up COVID scans very, very easily. So we didn't necessarily have to have our radiologist pondering over thousands of scans to actually pick out which one of these were COVID, because the software helped us or enabled us to get there. A second example is what many hospitals today are doing in digital pathology. So if you know that histopathologist is again one of the very rare species in India. The number of histopathologists to the kind of cancer prevalence in this country is extremely low. But using digital pathology today, we are actually able to pick up all the slides and the tissues. Instead of looking at them under a microscope, you can actually see them on a large screen. Using AI, you are able to actually diagnose which type of cancer, what is the grade. So all of these things today are helping in aiding diagnosis of patients. If you look at therapeutics, today we are working with monitors in ICUs, which actually based on data and AI are able to predict which patients are at a higher risk for stroke, which patients are at a higher risk for a heart attack. When these kind of scenarios are emerging, immediately alarms go out, SMSs can go out to doctors. So whether it is doctors, whether it is nurses, they are able to pick out the risks and they are able to intervene at a much earlier stage. More than anything else, I think the biggest potential for technology and data is in the lifestyle pandemics, which is the diabetes, the hypertension, the cardiac. Very recently, we read about an article where 85% of patients in a study were actually able to reverse diabetes simply by using monitors which were fixed on their body, which could continuously monitor glucose and send out signals to the individual that when is it time to take their doses, when is it time to have their meals, what is the impact of meals on their blood sugar levels. So these kind of devices, which are AI-based, IoT-based, can play a very, very big role in reversal of some of these conditions. So overall, if you look at it, whether it is prevention, whether it is treatment, whether it is the actual diagnosis, I think technology has a very, very big role to play. We are reaching a stage now where now with 5G coming in, I think the potential is only going to multiply. Very soon, we may actually be in a scenario where a doctor sitting in one city can actually be operating on someone in another city using robotics. So technology and data are going to touch various facets of the healthcare ecosystem. To me, the biggest advantages are that it's going to make healthcare more equitable. People in rural areas, like what Dr. Prasad mentioned, will have access to a care which could be similar to what one gets in cities. Because of the resource crunch in our country, like I mentioned about histopathologists, maybe about radiologists, sitting in one area, they can actually report and give their opinion to people who are sitting across the country. And third and most important thing is that through these diagnostic devices, one can be able to diagnose early, intervene early, so that patient visits to hospitals can actually come down and overall health status of the population in this country can improve. So overall, the potential of technology and data is immense. And if there is one field, and I always say that medicine now is becoming more and more about engineering, and Gautam, my friend who's an engineer, will surely be happy about that. But engineering is helping us and enabling hospitals and healthcare providers to do a much better job. Thank you.
Thank you, Dr. Santosh, for saying that medicine, healthcare is going to be technology driven. I think already with the pandemic, we have seen the same going on. So, next question would be to Mr. Gautam Khanna. With the launch of NDHM, we are witnessing a new beginning for India's health sector. Teleconsultation is the future of India's health system. Through the adoption of digital technology, NDHM will empower the health sector to cater to the country's large population in a far more efficient manner. What changes do you foresee as essential for this adoption?
Thank you, Dr. Minnie, for this. And just to respond to my friend Santosh, that there is increasing work going on in the technological institutes focusing on medicine. So the future will be at the cusp of medicine and technology, not necessarily engineering. So that is happening, and many global institutes are developing medical schools of research and technology. So so we have a future. So now coming to the telemedicine. So telemedicine, as you saw during COVID, took off, and we've had through the government portals, through eSanjeevani, we had more than crores of people who availed the benefit. Private players also had telemedicine across. And to give you an example, we are based in Mumbai, and we had patients from 260 cities, 10 in India, 10 abroad, and 250 in India, who consulted our doctors. So now think of it, pre-COVID, pre-telemedicine, this was impossible. They would have had to come physically, and you know what happens with that. So this has given access to the people in, like Dr. Prasad said, in a small town, you get access to a better care. So that benefit is known. The concern, however, is that technology is still to catch up, in the sense the comfort of a patient who comes to visit a doctor, and the doctor actually sees the papers, so the file which the patient has brought. There are multiple people. There is a resident who has taken some history. There is a nurse who takes care of the patient, talks to the patient, and the doctor talks to the patient, the consultant. That experience, if we can replicate in the e-environment, it will work. But if we don't, then otherwise e-consult will only remain like a second opinion, like a referral, and if anything major, you please go and visit physically. So that's one thing. Second aspect is, there is a little bit on the pricing aspect, and I think it's very dangerous to talk about pricing when we are in healthcare, because everybody wants it to be free. But think about it, that a consultant in a large city in Mumbai may be charging 1,000, 2,000, 3,000, depending on their level, for a consult which is maybe 5 to 10 minutes, or maybe 3 minutes, 5 minutes. That's what they do. And they have hordes of people outside the clinic. And I want them to do teleconsult for somebody in Jabalpur. I just picked up Jabalpur. It could be Durgapur, it could be Lucknow. Please don't mind. So somebody there, and that person is used to paying only 300 rupees or 500 rupees to the best consultant in the neighborhood. And you tell them, by the way, you consult with so-and-so doctor for 5 minutes, it's going to be 3,000. Very difficult. The second thing is, this consultant will say, okay, here I am getting 2,000 rupees for a 5-minute consult, but in the e-consult, it takes me 10 minutes because, I have to set it up, he's not come, so 10, 15 minutes, and you're giving me 300 rupees. There is a little bit of a pricing model which has to be fixed. And not that this model is not working, but this has to be thought through. The other thing which I think the providers have to think, we have to think, is that if we don't do it, because of all these problems which I just mentioned, if you don't do it, somebody will do it. So somebody will do it is that there are new players outside who will unlock this demand, and suddenly, you have many startups who are now in telemedicine. So they will take it. So they will be more efficient, and for routine cases, that consultation which we were getting will go away. And with OPD, you get conversion to IPD, that will also go away. So it is in our interest to have some kind of a formula to work on that. The other thing about e-consult is, we've been talking about, we are all are in our hospitals. We are not in healthcare, we know that. We are in sick care. So people come to us not when they're healthy, they come to us when they're sick. So we are in sick care. But a lot of benefit of e-consult will be when people utilize the e-consultation and all this technology and digital for preventive health, for being healthy. So we ourselves need to transform, the providers need to transform our mindset from being a sick care to healthcare. The moment we transform from sick care to healthcare, all these things will fall in place. So I don't know whether it answered your question, Dr. Minnie, but thank you so much.
Sure. What about Neeraj Lal? Is he joining us? We can proceed. Okay. So I think from all the speakers who we had, it shows that digital healthcare after the pandemic is just enhancing itself. and people, whether you are in a rural area or in an urban area, are falling as digital support. They are falling as a support for this. And what we see is mainly people in rural areas are adopting it. The people in urban areas are still to adopt it, and rural areas are benefited by this. But at the same time, we see that in urban areas, there is some motivation which is required, which may be whether it is to adopt the Ayushman or whether it is on the side of the healthcare, whether people in healthcare adopt the same, whether it is the staff working in healthcare or into the operations and management. Yes, there are challenges of data capturing, as Dr. Santosh has said, as well as the challenge of mindset and IT, as well as we see when Dr. Meena says about the quality and also the challenges of a speech text which is still to be recorded, because you see that people in healthcare are changing a lot, and that gives you the challenge of a speech text. Motivation to this technology and benefits of what you will get will need to be incorporated, and it needs to be told to and spread across the country. As you see the evolution of ABBA, and as very rightly said by Gautam, the price differencing is going to be the challenge, but the accessibility of records is going to be something which they need to look at. And also accessibility and affordability of the treatment they are getting all over India. So I think that with that, at present, we could conclude this session, and I would like to thank all the speakers.
Thank you, Dr. Minnie, for so expertly leading this session for us. I thank Dr. J.L. Meena for staying with us virtually. I also thank all the delegates present with us and our guest speakers for this session. I request Mr. Dilesh Dattani to please felicitate Dr. Rajiv Prasad. I request Mr. Gaurav Agrawal to please felicitate Mr. Gautam Khanna. I request Mr. Abhinav Thakur to please felicitate Dr. Santosh Shetty. I request Mr. Prabdeep Singh to please felicitate Dr. Minnie Bodhanwala. Thank you to all our guest speakers.